learning about Microsoft Excel, as well as PowerPoint. And I think
Oh, good morning, everyone. Apologies. I think Teresia has dropped off. Can you hear me? Great. So just finishing up from what Teresia was saying. So we've had a series of workshops really to empower women living with non-communicable diseases. And today we're just delighted to have our partners from the Barbados Association of Endometriosis and PCOS partner with us to deliver this session on amplifying your voice. And this is going to be a self-advocacy workshop for women living with chronic diseases. So Julia Mandeville is the co-founder and public health manager at the Barbados Association of Endometriosis and PCOS, and Vania Patrick-Driggs is the clinic counseling officer, the counselor at the Barbados Association of Endometriosis and PCOS. So without further ado, just quickly just to say that if you have any questions or comments or that you'd like to make throughout the session, feel free. You can put them in the chat and we'll obviously get to them at the appropriate time. This session is being recorded, so you can access it after the session and we'll make sure that you get that. And just really sit back, relax, and enjoy the session. So I'm going to hand over to our speakers now. Over to you, Vania and Julia.
Hi, good morning, everyone. I am very excited to be here, albeit virtually, really excited to be engaging with our sister Caribbean country, St. Kitts and Nevis. I'm also really excited to be joined by my colleague, Mrs. Vania Patrick-Driggs, who is the counseling psychologist for our organization, the Barbados Association of Endometriosis and PCOS. My name is Julia Mandeville. I am, as Abby mentioned, one of the co-founders of the organization and the current public health and advocacy manager. And before we jump right into it, we'll give up some introductions. So I will introduce myself and then have Vania introduce herself in her professional capacity, which more or less also ties into what we're doing here now. So I am a public health professional by practice, and I am currently a PhD student, doing my doctoral degree in public health as well. But all of this stemmed from my diagnosis with endometriosis. So endometriosis is a chronic condition. Some people would also characterize it as an NCD. And we thought that this organization was really important when we started to have these conversations amongst ourselves in Barbados for these conditions like endometriosis, like PCOS, that really weren't being seriously addressed. They are resources, but a lot of it is very hodgepodge. There's no real connectivity within the resource system there. And so we thought it was important to develop this organization to raise awareness about the conditions, one, to highlight whatever resources we have available, and three, provide a space for advocacy, whether it be organizational advocacy or what we're going to be discussing here now, self-advocacy, particularly with these conditions where there's not a lot of awareness. Sometimes it will be difficult, and it has been difficult to communicate what exactly is happening. For instance, with endo, there's an associated with chronic pain, chronic pelvic pain. There's also an association with fertility, infertility, and mental health issues. And so those are all, for a lot of us, those are areas that are very stigmatized. We don't like to talk about them amongst our family and friends, and we definitely don't want to talk about them with our, employers, with our colleagues at work, because we think that those are very private matters. But what we've recognized is that there is strength in having these dialogues and having these conversations, because you don't know who you may be helping in the interim, and then you don't know what societal changes can't come about because of the speaking up. And we've recognized that in Barbados. And so we hope that, we are able to impart some of the lessons learned, bearing in mind that our context in Barbados is going to be different from your context in St. Kitts and Nevis. But, you can always apply lessons learned that are applicable to you. And yeah, we're just excited to be here and to share and to have this dialogue. So as Abby said, sit back and relax, but we also want engagement. And I will now turn over to Vania for her to introduce herself.
Thanks, Julia. Thank you for setting that context so nicely. And good morning, everyone. My name is Vania Patrick Drakes. I am the psychologist, the counseling psychologist with BAEP. I am also pursuing my PhD. I am looking at policy. So I've been in mental health, in the mental health field for quite some time. I quite enjoy it. I especially enjoy facilitating these conversations within groups. So I'm very excited to today's session. I've moved towards policy because I've realized, like there are disproportionalities that exist for marginalized communities across a number of sectors, health included, right? And I'm really interested in pursuing research opportunities, collaborative opportunities to kind of understand more about these disparities and to advocate for equity and equitable change. And part of that, of course, is within the healthcare sector, within this field, and dealing with chronic conditions, NCDs, including PCOS, which I was diagnosed with as an adolescent. So I am familiar with a lot of the unfortunate symptoms that are associated with PCOS. I empathize with other persons who have other conditions that also can be affecting your day-to-day functioning. And that's why today we want to talk about it. We want to talk about health literacy, and Julia is going to go through that in a bit. And then later on, I'm going to be covering self-advocacy. So workshop expectations, right? Usually when I join a Zoom workshop, I join because I'm a bit interested about the topic, right? But then I might click my computer on, and then I go and I might cook some breakfast or some lunch. I might find myself also watching a little Netflix in the background, or scrolling IG or scrolling TikTok or whatever. And we're hoping that this is not the experience that you have today, right? So if Julia's talking all the time and if I'm talking all the time, our voices might get a little drony. You may not be as dialed in. So we really want your participation as well. If you feel like there's anything that resonates with you in the chat, please put it there. If you have any questions throughout the session, we're not leaving questions until the end. So if you have any questions, please raise your hand and we'll be happy to get to you, or place it in the chat and we'll nudge each other to check there as well. Take advantage of the Zoom function. So I'm looking, I can't see it on mine, but I hope on yours you have like the reactions and so on. If you do, feel free to use them. And by the end of today's session, we are hoping to empower women living with chronic non-communicable diseases in St. Kitts and Nevis via self-advocacy and health literacy knowledge and strategies, right? So living with a chronic condition often is not easy. And we want you to emerge from today's session with tangible takeaways that can improve your everyday functioning. So as we go through today's session, we're going to use videos. There are going to be some exercises, some reflections. For the exercises in particular, you're going to need something to take notes with. So whether it's a notes app on your device, whether it's a dedicated notebook or a piece of paper and a pen, I'm going to keep talking while you go locate that now, because we're going to be using it in just a few. But I'd love for you to be able to, have something dedicated where you can take notes and where you can participate in the exercises throughout today's session. Right, so the next 2 hours, hour 50 minutes is carved out and is dedicated just for you. Do you have any questions so far? If not, let's go straight into the agenda. So what today is going to look like, right? So we've already had the welcome from Julia. I've done some housekeeping. We're going to do a pre-workshop check-in, and we're going to set expectations for ourselves within the session. Julia is going to cover part 1, health literacy, and I'm going to be facilitating the self-advocacy bit and going through some goal setting, and then we will close at 1. So let's do a little bit of a check-in. Because again, this space is just for you today. And I know sometimes as adults, we tend to be going. Very few opportunities carved out to check in on ourselves, right? So you see how I'm sitting now? No, I'm gonna sit up a little bit better. And let's take a moment to look inward. So how am I feeling today? And I'm gonna pause as we just reflect on the questions and give a response in our own minds. How am I feeling? And how is my body doing today? You can try lifting and lowering your eyebrows. Is your forehead a little scrunched? Sometimes that happens if we are squinting, if we are feeling tense or stressed. Is my jaw clenched? And if it is, let's get some movement in there. A clenched jaw can also be an indicator, often an unnoticed indicator of tension or stress. Am I carrying tension in my shoulders? Right? Sometimes our shoulders are also very tense. So let's introduce some movement in there too. A wiggle perhaps, even if it feels a bit silly. A shoulder roll either forward or backward. Let's make sure that we're seated in a comfortable place and a comfortable position. And we can continue to scan our bodies, our torso, our legs, our feet. We can wiggle our toes. Often our toes don't get a lot of love. Let's make some adjustments as necessary and scan the space around you. Are you in an optimal space to get what you need today? Is there any way to make your space more appropriate for you? Do you have your notebook, your note app ready?
You know what, miss? We missed the sale if you want to go next week.
Let's check in to our minds. So what's moving around in there? What is at the forefront of your mind today? What's second and what's third? And what's on your heart? So as life does its lifing, let's make sure that we're making the best of these 2 hours. We're cultivating these 2 hours as a space for introspection, for self-exploration, for learning, for affirmations, and for goal setting. We do have a preliminary exercise at this time. So again, we have here a few chronic conditions that can have profound impacts, right, on our daily functioning, our self-esteem, our levels of pain during the day, our family planning, or physical health, or mental health. And of course, we're here to learn today about health literacy and health self-advocacy. So let's take a moment to consider these prompts, and then we're going to record our responses, right? So number 1 says, I currently live with, and you will write this down and fill in the chronic condition that you currently live with. And this is just for you. We're just checking in on ourselves today. And I have been living with this for, and you fill in the time period. Number 2 says, on a scale of 1 to 10, where 1 is poor and 10 is excellent, my experiences with the healthcare system have been, and you can fill in the rating for you. B is my knowledge of ways to advocate for myself is, and you fill in the rating for you. Do you know how to advocate for yourself, particularly within healthcare spaces, within the workplace? Part C is, my confidence in advocating for myself is, because I can have the knowledge, but if I don't feel comfortable speaking up, that's also a factor. So part C is questioning your confidence in advocating for yourself. And when you give your rating, you can also jot down why. So let's say my rating is an 8, it can be because of X, Y, Z. If my rating is a 3, it can be because of. And then finally, number 3, I am here today because, and we may all be here for slightly different reasons, but take a moment and kind of think, why did I sign up for this particular session? What am I hoping to get out of this particular session? And write that down. When you are finished, please indicate that you're finished in the chat. I will be looking out, right? We're all interacting today so that I will know that it's okay to continue. I see some of you indicating so far that you're finished. Thank you so much. Thank you, Dr. Stones. Okay, I'm going to wait for just 2 more persons to indicate that they're finished, and then we will move on to health literacy. Thank you. No problem, Bernice. Thank you, Shanna. Okay, I've gotten my 2 persons, so Julia, I will pass things on to you.
Thank you so much, Vania, for really setting the tone for this session. And I think it would be great if I could actually start talking about health literacy, answering the questions you pose, because I really love the fact that you did that. So again, currently I live with endometriosis. That is my chronic condition, and I have been living with it for 20 plus years. I will rate my experience with the healthcare system as 7, between 5 and 7, give or take, depending on the day. My knowledge of ways to advocate for myself right now, I would rate myself as 10, as well as my confidence as 10. Why? Because I have had the experience, I have had the information available to me, and I have had a strong support system that has encouraged me to advocate for myself, particularly after my endometriosis diagnosis and after they understood what this condition entails. Why am I here? I want others to also have that feeling of confidence and also have as much knowledge as possible to advocate for themselves so that they can also rate those particular variables as 10 at the end of the session, or, you know, at least an improvement from wherever you are rating yourself now. And so again, really just wanted to set the tone using those responses. Thank you, Vania. So what is health literacy? So I think we all have an idea of what literacy is, sorry. So reading, writing, understanding, which is great. But then when we talk specifically about health literacy, it really means that interpretation of the information that you are either receiving from your doctor, as you can see here, receiving from others in your everyday life. Because, you know, it's not just the medical providers that are giving you information that could impact your health. You encounter health information, whether explicitly or directly or implicitly, as it relates to ads on television, ads on the radio, things you may hear from people at church, things you may hear from people at work. And health literacy really does help with the interpretation and the filtering of that information for you to more or less retain the information that would be beneficial for you to make good decisions about health. And we're going to really talk about your health as we move forward. So with this video, we just wanted to kind of lay the groundwork and explain what we're going to be focusing on today, which is personal health literacy. So it should be like a minute or so. We will definitely stop at the 1 minute mark for the video. So over to you, Vania. We are not hearing the audio. So you may have to go to the
Ha,
screen.
no, I was just muted. That was just very silly. My apologies. Here we go again.
Sometimes people can be confused by the information given to them by their doctor or pharmacist. They may end up taking their medications the wrong way in the wrong dose, or at the wrong times because they're not sure what to do. Personal health literacy is when individuals have the ability to find, understand, and use information to make decisions and take actions for themselves and others. You can increase your own health literacy by asking questions and getting answers. To avoid misunderstandings, healthcare providers should use simple language and avoid complicated medical terms that only they understand. You can also increase your own health literacy by repeating back any instructions your doctor, nurse, or pharmacist gives you. It's a good way to check that you understood. You can also bring someone with you. Health literacy can help to prevent problems and protect your health, as well as manage existing problems and unexpected situations that may arise. The Institute for Healthcare Literacy
Sorry.
into their life.
1 minute spiel of more or less kind of summarizing what we're going to be discussing today. So that is personal health literacy. There is also something known as organizational health literacy, and that more so applies to healthcare institutions. But right now, again, we are focused on self-advocacy. And so with self, we're also focusing on you as an individual and tools that are really applicable to you as you navigate your journey within healthcare. So again, it's how well a person can find and understand the health information as well as the health services that they need. And so it's important to note that part. Sometimes we forget that. But again, as I said in the beginning, when we started our organization, we were aware of some resources, other people were aware of other resources that could have been beneficial to other people. And so it really was not as smooth, or it wasn't as integrated. The healthcare system wasn't as integrated for our conditions, our chronic conditions, as we believe it can be. And so being able to identify services that you need for that specific healthcare concern you have as quickly as possible is really, really important as well. It is a very, very critical component of your health literacy. Knowing, it's important to go to your OBGYN for your women's health. And then you also have an endocrinologist, which is another practitioner that will provide support for your hormonal health. And whilst there can be an overlap with those two medical specialties, one is specific for one area and one is specific for the other area. And so once you understand what your healthcare concern is, you can then make that educated decision as to who do I need to go for this specific concern. Or in some instances, it may be you're going to your general practitioner and you need a referral. So again, if they're referring you out, who or what is the resource needed for this particular healthcare concern? So I just want to really reiterate that, yes, it's about finding information online or, through interactions like this or interactions with your social network, and then understanding that information. But it's really, really, really important that you can identify those services that are available to you when you need them. So again, personal health literacy really means getting, understanding, and being able to act on that health information to make health decisions and look after your health and be able to access those health services. So what do we need to do? And what are the key components in personal health literacy. And I know we signed up for a self-advocacy workshop, and it's like, what does this have to do with self-advocacy? It actually has a lot to do with it, and I'm working up to it, so that, it will be a great segue into Vania's session, but just bear with me as I go through what personal health literacy is. So again, understanding how your healthcare system works. So again, that's going to vary depending on context. So the healthcare system in St. Kitts Nevis is probably very different from the healthcare system in Barbados. And our healthcare systems are probably very different from the healthcare systems in North America. And so it's also important that if you are moving around, whatever context you're in, getting a basic understanding of how the healthcare system works. Do you need referrals, right? Again, I mentioned, you may have a general practitioner and you have a concern that is not within their specialty. How does your referral system work within your country? How does insurance work within your country? And then when I'm talking about insurance, even though I don't have it listed here, insurance through your employer, what does that look like in relation to the healthcare system? Do all medical providers accept types of health insurance, or is there just one that only accepts these specific types of health insurance, or is there this practitioner that doesn't even accept health insurance whatsoever, and you have to pay out of pocket? So like I said, it depends on context. That is the context in the US. I'm aware of that. In Barbados, I believe health insurance acceptance will vary based on institution. And so it's really important to know if you are going to go to a particular healthcare provider within your healthcare system, and you are hoping that your insurance would cover it, understand that would probably be in your best interest to do a review of the insurance coverage that is accepted, right? Also understanding, so again, I'm going to use our Barbadian context just because that's the context I'm familiar with. In Barbados, we have these clinics throughout Barbados known as polyclinics. There are about 9, and depending on where you live in Barbados, it's called a catchment area. So you have to go to it. Typically, if you are going to the polyclinic as an outpatient, there is a particular polyclinic that, based on your catchment area, that you should be going to. So again, just understanding, and again, going to use the Barbadian context. I'm from Christchurch. Vania is from St. Peter. I should not drive all the way up to St. Peter to get the polyclinic unless there's really specialized care there, because that is not my catchment area, and vice versa. Again, being able to communicate with your healthcare providers. And this is not to say that you need to have studied medicine. It's really trying to ensure that it's a bi-directional conversation you're having with your healthcare providers. A mutual level of respect and understanding really is foundational for that relationship with your healthcare providers to work. Making notes of your concerns, walking with a notebook, and I'm going to kind of keep mentioning that, or something to either provide information that your doctor may be asking for as it relates to your concerns, or also being able to document what they are saying so that you can go home and then review it and see if what can apply, what other research is needed, because doctors in certain situations are not going to have a significant amount of time to sit with you as a patient. So it is in your best interest for you to take that information and take the time you need and not feel rushed within the doctor's office to really think through what is happening. Knowledge of medical words and terms. So this is here, and I have an asterisk because we're not asking you to be doctors or nurses or medical providers, but particularly for your chronic condition, your lifelong condition, having an understanding of the terminology, or just a recognition of the words associated with this condition, the medications, the treatment options, so that you just have a more concrete understanding of the condition, everything else that comes along with it, would be in your best interest. Another reason for the asterisk is that if you do not understand that terminology, please reach out and ask a question. Asking questions is so critical for your health literacy. A lot of the times we don't like asking questions. I'm guilty of this in many occasions because we don't want to be perceived as weak or stupid, for lack of a better terms. But asking questions is really important for you to address those gaps in your knowledge, right? We don't know it all. We can't know it all. But someone may have the answer to the question that you have. And, for me, I swallow my pride, I swallow my ego, because if there's something I really need to find out, and I don't know, I am going to try to find that subject matter expert. And so I think in terms of these chronic conditions, and that subject matter expert doesn't have to be someone with a professional designation. It could simply be someone who has had this diagnosis for this chronic illness for a longer time, who's been in this space for a longer time. And so they are equipped with the knowledge, and they can then disseminate or share that information with you as well, so that then now you have that in your repertoire. And again, that goes back to the ability to finding health information. For us at the BAEP, we are really stringent in terms of having what we call evidence-based information. And what this means is that it is information supported by robust research. There are caveats with that, but for all intents and purposes, that typically is the best type of information you can really have an access to apply to learning more about your condition. But again, please ask subject matter experts. You can ask the medical professionals that are the ones entrusted with the care, and you can ask patient advocates or people that don't necessarily consider themselves patient advocates, but have an understanding of the condition because of either their lived experience as the person with the condition, or even their lived experience as the person being a caretaker for the person with the condition. And so it is really important to find that health information, and it goes back to computer skills. So if you go on Google, go on Bing, type in something into the search bar, you're going to have a lot of options being presented to you when you search. So being able to navigate that, that would be a whole nother section on itself. But being able to navigate that and just recognizing what would be considered a reputable source. For us, the most reputable source as it relates to health information would be the World Health Organization or the Pan American Health Organization. In the US, it would be the Centers for Disease Control and Prevention, CDC, and then healthcare systems, which would have information available online. And their information really needs to be accurate because they need to recognize that people are coming to their websites to look for this information, and there's a liability if there's incorrect information on their websites and people are following that as guidance. And so just being able to identify, this is a reputable website, this is a reputable source, this is a trusted source for information, is also really important as you factor in these items within your personal health literacy. And then reading, writing, and numeracy. In the video we just watched, we saw that there were these medication bottles. One was more or less showing what a doctor could potentially write if they were writing it in medical and clinical terms. And then the other was showing, that was not going to work. It's important to have it in information that the patient can access. And then it's then important for you to be able to apply your reading, writing, and number skills in following the guidance given on that medication. So, just number skills in that, it says to take 2 of these pills twice a day versus 3-4 times a day, and being able to just, again, rationalize and interpret the information that is being provided to you within that context. And again, it also then goes all the way back up to being able to find that health information, identify reputable sources. And I did mention the World Wide Web, but books are still a thing. We can go to a library. I see Vania smiling, but books are still a thing. We can go to a library, and then also being able to navigate that space to find resources is also something that you can keep in your personal health literacy repertoire. Why is it important? And I think throughout this conversation, I've been kind of hitting on these points, whether it's implicitly or explicitly, but it really does boil down to your ability to make good decisions about your health. So again, taking medication, additionally, whilst this is not something that was mentioned before, even recognizing where you are right now and how you feel in your body. So I was really happy Vania did that grounding session, because it's important to also recognize stress is a very big component of health outcomes. And finding information, reading up on, ways in which you can reduce stress, ways in which you can reduce anxiety, ways in which you can make your life a bit more, a bit easier as you navigate, especially with a chronic condition, that will help you make good decisions about your health. Getting the medical care you need. So again, ensuring that the practitioner you are going to is the one that would be the best subject matter expert for that health concern. Ensuring that the medication the pharmacist is giving you is the medication that you should be given. And so that also really incorporates point 2, you get your medication, reviewing what is on the packaging, ensuring that you're taking it correctly. And I also want to reiterate here, whilst reading and understanding how to take the medication is important, also ensuring that you take the medication as it's prescribed, as it pertains to the course of the medication. Again, we as a people, myself included, have this bit of when we feel better, we can stop taking the medication, right? Right, because we feel better, so we don't need it anymore. That is not ideal, right? It is important that if you feel better, you take the medication throughout the course that was given, or conversely, if there are side effects and something just isn't feeling right, have that conversation with the person who prescribed it, let them know what is happening. Again, make notes of your symptoms, make notes of any signs, make notes of even changes in your mood and feeling with this medication that just aren't sitting right with you, so that you can have that joint plan, because again, it is a partnership with your healthcare provider as to what next steps need to be in terms of taking your medication correctly. Again, when we feel bad, we have a habit of, we're not taking it, we're going to stop taking it and see if we feel good. And whilst I understand that, it really is important to let your healthcare provider know that you plan to stop taking it, that you want to stop taking it, and list the reasons why, so that if there is something else available, you can access it sooner rather than later. And then all of this filters down into managing your disease, especially a chronic disease. Chronic disease is really mean, lifelong. Once you have it, you have it. And so it really is about navigating your life course with the addition of having to manage this chronic condition. And so whilst it's not always going to be foremost in your mind, it is going to be a very persistent feature of your life. And it really is important that if you want a really high quality of life, whatever that looks like for you, you have all of the information, access to all of the resources, access to all of the materials that can help with the management of this disease, so that the outcomes and side effects are as minimal as possible for you. And then that leads into leading a healthy lifestyle. And I think that's why it's important. But why is it important to self-advocacy? It is important to, the focus of our chat here today is because it really will increase your capacity to reach your health-related goals. I'm going to use the example for endometriosis, where for some people, it's just about pain management. For other people, it's about fertility issues, and people have different goals. And so knowing what those individual or joint goals are is going to be really important to have the information and resources listed to help you navigate to reach those goals. And so if you can get the right information and understand it, you can be better equipped to advocate for your own health. And we also want to really consider the fact that when you go out in the community and you are dealing with symptoms of your chronic condition, or you're at work and you're dealing with symptoms of your chronic condition, and people aren't understanding, having that personal health literacy is important to, if you want to explain, because again, that is your choice. If you feel as though it's a space to explain what is happening to you, then you have that information that you can say, this is my condition, these are the symptoms, and this is my chronic condition, these are the symptoms, this is why I'm experiencing this, and this is what I need. If it's a case of what do you need to help support you on this journey, it really helps with you feeling more confident in not just speaking to medical practitioners, but also speaking to people within the community, because you have significant information about what is happening with you, what it means to have this chronic condition, and what resources are needed, what works and what doesn't work for you. Because a lot of the times people would want to push, try this, try that, without really understanding the condition. So once you have that information, you can say, I hear what you're saying. However, I know my condition, and I know that might not be in my best interest, but I appreciate you trying to help me, right? You can always be nice about it, but then you can also say, if you want to learn more, I am willing to have that conversation. And again, it depends on whether you're willing or not, but it really just empowers you to feel more confident to advocate for yourself in whatever setting you may find yourself. So I believe that's it for me. Oh, so 3 more slides, sorry. And so ways in which you can increase your personal health literacy. So the acronym is RARE. And I'm not going to read every single point on this slide, I'm just going to summarize it. So ask questions. Ask questions about what you're not understanding. Ask to learn more about the condition. Ensure that the information is being presented to you in a language you understand, whether it's spoken, whether it's written. If the doctor or healthcare provider has pamphlets, leaflets, can direct you to a website, get that information. And then ensure that the information that is being provided is reliable. So you can ask, is this a reputable source? And ideally, they should say yes if they're a healthcare provider. And then you say, okay, great. And it increases your confidence. And again, it should also improve that bi-directional relationship with your healthcare provider, because now it's a conversation. It's not just them telling you what to do, it's you also having that vested interest in your health to ensure that you are clear about what the plan is. And you can also say, well, I don't feel comfortable with this, or maybe we can try this. And again, just develop out that relationship. Retain. So you're asking, but it's also important to remember. And people like me, we have brains like sieves, so we can write it down. So write down your questions, write down your symptoms that have been bothering you, that are leading you to the healthcare provider. Repeat. So in the short video, we saw that you're encouraged to repeat exactly what the healthcare provider is saying to you prior to leaving that space. Make sure you understand, make sure they confirm that this is what you have to do. And then again, if you're like someone like me and sometimes, you have what we call brain fog, bring someone else along. It's really good to have someone else that can also be an advocate for you and can also be like, you remember the doctor told you this as opposed to that. And so that is another form of retention, or just keeping the information as close to you as possible. And then evaluate. I think I've said this in multiple ways, but I just want to reiterate how important it is to have reliable information, because of it really is could be a matter of life or death if you inadvertently access wrong information. So ensure that you have that reliable information, evaluate it, and then again, evaluate your context. Again, my context, Vania's context, the context in St. Kitts, they're all very different healthcare, social, employment context. So it's important to evaluate that space that you are in and make the best decisions possible with all of the information you have. And so ARE, ask, retain, evaluate. And those are key ways to increase your personal health literacy.
Brilliant. Thank you so much, Julia.
Thank
I'm
you.
wondering if there are any questions on personal health literacy before we continue. Questions, comments, perspectives. Yes, Teresia.
Thank you, Julia. I just had one additional comment to make, and it was with regards to seeking second opinions. And I think it's very important for us to recognize that as an option. And I know we sometimes shy away and don't want to be that problematic patient, but if we feel like we're not getting either not getting answers or not getting the standard of care that we would like, it's important to consider that option. And I think that would fall under the sort of evaluate portion of the ask, retain, and evaluate acronym.
Exactly. Thank you. Thank you. That is such an important point. I appreciate that you reminded us of it. Thank you.
Thank you. And anyone else? Okay. If not, we're moving on to this imaginary doctor of yours. And this doctor can exist in a couple different, let's call them modalities, right? So let's say, I'm going to keep him playing. This is, let's call him Dr. St. John. And Dr. St. John is smiling at you right now, but he's smiling because he's happy. He's received his money. Yes, he's kept you waiting until 2:30, even though your appointment was at 11. So he completely overbooks his patients. And as he speaks with you about your symptoms and so on, he's kind of rushing through. So you're talking and he's like, yes, 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 yes. And he knows exactly what you're saying, even before you've said it. And he's saying, well, you know, women experience this. This is not novel. Go lie down and take 2 Tylenol or take 2 Panadol if you have Panadol in St. Kitts, and you'll be okay. That is one thing. He's using very technical language. You're asking questions, but as soon as you want to ask something, he's like, oh, you know, if you go on WebMD, you'll find some more information there, right? Completely dismissive. Or we have the option of Dr. St. John again. Again, he's kept you waiting for a long time, and you realize that he does this habitually. So perhaps we may have to say goodbye to Dr. St. John, because time-wise, I may be a busy partner, busy with my work, busy as a self-employed person, and I don't have 3 hours necessarily to wait every single time in my healthcare provider's office. He is telling me about my condition, and I'm, you know, very confidently saying, you know, I hear what you're saying, but that's not my personal experience. And he's smiling because he's like, okay, so this patient is coming with actual, you know, I guess, confidence and making sure that they're saying what it is that they have to say for themselves, right? He's prescribing medication and you're saying, well, I think I've used this in the past. I'm looking at my notes. I don't think that worked for me. He uses technical terms and, you know, excuse me, doctor, can you explain a bit more about what that means? He's taking the time and you're taking the time, and it's a better healthcare provider / patient relationship, right? And I think when we're looking at advocacy and self-advocacy, particularly within this context, that's really key. And it's not just relationships with healthcare providers, it's relationships with other persons within our sphere, right? Which we'll speak about in a bit. So if I'm looking at advocacy, it is speaking or acting on your own behalf, right? Advocacy can also be acting or speaking on the behalf of someone else who needs it. So someone else in your care. And I want to talk about adolescents, especially a bit later on too, because sometimes if you are a parent or you're an adult of influence, you may also have to advocate on behalf of someone else, because we know often these conditions may not be diagnosed on time. They can be minimized, unfortunately, in terms of symptoms. And then we find children and youth not getting the care that they really need, right? So it is ensuring that your experiences, that your perspectives, and that your needs are heard. Often we're saying something and it kind of feels like someone's not even listening, right? And I've had experiences, great experiences with healthcare providers, and then not so great experiences, right? Where it feels like I'm talking and you're just not even listening, because in your head, you already know exactly what's going to work for me, you know exactly what's wrong with me, and therefore everything that I say is just kind of like fluff. That's not what we're looking for, right? We want to make sure that we are feeling heard, because yes, we may have similar conditions, but our experiences with them may be unique. Our responses to medications may be unique. And it's important that we are aware of that, and that whoever we are with on this healthcare journey is also aware of that, so that we can work together towards the common goal of easing symptoms, of optimizing our lives and our well-being, right? And I have this little image at the bottom. It is often, again, as adults, as women, there may be the inclination to put others ahead. Okay, I have my pets, I have my parents, I have my job, I have this, I have house care, I have cleaning, I have children, perhaps nieces, nephews, godchildren, and I want to make sure that they are good. So I'm going to keep doing for them. I'm going to keep doing for them. I'm going to be outperforming at work. I'm feeling awful at work, but I'm still pushing because I'm perhaps a perfectionist. I'm ambitious. I want to succeed, but all of this at the expense of what or of whom, right? I use this situation all the time. I'm going to use it again here. You're outperforming at work, you're doing well at the expense of your health. And then let's say, unfortunately, it's not what we want, but something happens to you and they will close for half of the day, and then they will open and your position will be up, right? They will hire someone else in your position. And where are you? Okay. So it is important to put yourself from that third place spot and bring yourself up to priority, right? We are advocating for ourselves for the sake of ourselves. So what can self-advocacy look like? It may look like being intentional about healthcare, including being intentional about healthcare providers. Now, this can be difficult. There can be constraints on this based on finances and so on. Ideally, healthcare providers within the public healthcare system would be patient and willing to listen to your needs, but I want to also look realistically. That is not all of the time the case. I am not certain of the context in St. Kitts and Nevis, but if there is the capacity to look for a doctor who works well with you, to not settle for a doctor just because, well, this is the only one I know, but to actually have one in your area that specializes, that understands the condition that you have, that works with other persons with your condition, right? It will be really useful to be intentional about your healthcare provider and about your healthcare, right? And that goes back to the previous point, in that sometimes we're just going. I have pain, but I've been told in the past that this is just what women have, right? You're supposed to be in pain. So I just kind of deal. Yeah, yes, Joanne, I see a hand. Thank you for that. Go ahead.
Yes, good afternoon now.
Yeah, almost.
Okay, you just mentioned about when you overextend yourself for everybody else.
Right.
Yes, so without saying too much, I can relate to that because I became ill in 2018
Mhm.
and was placed on sick leave. 2018 June, was placed on sick leave until the September. And from then until now, I ended up advocating for myself.
Mhm.
I can't say too much because I'm on pre-retirement leave right now.
Mhm.
So long story short, what has happened is that I had to end up retiring early. So I'm in that phase right now.
Mhm.
So I would encourage everybody to take care of yourselves. Don't think you can overwork and not be impacted negatively,
Mhm.
because it has been a fight for myself from 2018 until now, but I never gave up on myself. But like I say, I can't say too much regarding it, because of
Got it.
where I'm working. It's for
Mhm.
government. I can't go into too much.
Okay.
Okay?
Yeah, no, Joanne, thank you so much for sharing.
Yes.
I appreciate you sharing your story for others. I wish you wellness. I wish you good health, mental, physical, emotional, all of it. Yes. Okay, yes. So, oops, admin. So yeah, so we want to be intentional about not just our healthcare providers, but about our healthcare, right? So like Joanne just mentioned, not waiting, making sure that we prioritize ourselves, identify and prioritize our needs, right? And again, we may feel like okay, but maybe not as important. We may have been taught or socialized to kind of put ourselves on the back burner, right? Yes, I need this, but I don't want to ask. Julia mentioned earlier, not necessarily wanting to ask questions. It can also go towards not wanting to ask for help, right? I don't want to be a burden on somebody else. I don't want someone to feel stressed out on my behalf. I don't want to seem weak. I don't want to seem like if I can't handle myself, perhaps people may see me as less of a woman, less of a employee, less of a whatever, and therefore I put my own needs on the back burner and prioritize someone else's needs, right? Not necessarily what we want to do. We want to make sure that we're prioritizing ourselves. Clearly communicating our experiences and needs within various spaces. And I mentioned various spaces because we've focused heavily on like the healthcare field and speaking up with our doctors, our providers, and so on. But it can also look like speaking up within our family circle, right? Or speaking up amongst friends. So if I, for example, let's say PCOS, a symptom may be really, really heavy periods, okay? And it can get to the point where it's debilitating, not leaving home if it's not being managed, okay? My friends really, really, really want to go to this place, right? So, and I haven't hung out with them in a while and I've been avoiding. And now I feel uncomfortable saying that I'm not able to come. I don't need to share all of my business, but just being able to say, you know what, I've set this boundary. Here's how I'm feeling. I don't think I'm able to make it. Please go enjoy yourself. Feeling comfortable, right? Identifying and communicating that I'm not having a great time right now and normalizing it too. Because sometimes when we look at conditions, especially like pelvic health conditions or reproductive or menstrual health conditions, we kind of stigmatize those, right? We're not supposed to talk about periods. So therefore, anything related to endometriosis, anything related to PCOS, anything related to fertility, any of that, we might be like, that's not a talking point or that's not appropriate to say. And in doing so, even though we understand why we do it, we are perpetuating that stigma that is attached to these conditions. So just normalizing it, right, is also very important. Negotiating and asking questions assertively. Let's use the example of being in a workplace. I need to be aware of sick leave policies and so on, right? What is available to me? For example, within my workplace right now, I have X number of sick days. And in my first year, I was very hesitant to take them, right? I was like, oh, yes, they're there. I'm happy they're there, but let me push through. Really? If I have sick days, if you have sick days, please take them, right? If you need them. That's why they're there. Learning as much as possible about your condition, right? And again, from credible sources. And Julia mentioned, I think World Health Organization, PAHO, as some credible, sources that we can go online to learn, and books. Books are great. Make sure that we're looking at updated resources as well, especially if we're going to the library. The library that I may have visited in Barbados may have things from like 70s and 80s. So let's just make sure that we're using things that are as updated as possible. If I have a condition, I need to know about it. I need to know my triggers. I need to know possible symptoms. I need to know treatment options so that I can discuss with my doctor and, okay, would this be suitable for me? I've tried XYZ and this doesn't work perhaps. And I've read about, we need to be as aware as we can be. And finally, persistence. So just because I go to Dr. St. John and I say, actually, Dr. St. John, XYZ, that doesn't mean that he's going to be smiling and like, oh, very good, Vania, you're advocating. No, he might be very annoyed, right? And be like, you know, how are you questioning me? I am the doctor. So it's important to have persistence. To you are again advocating for your own health, for your own life. And if you're not receiving the quality of care or the quality of attention that you need in one sphere, you see if you can go in another direction. All right, so why self-advocacy? We're gonna just hear like a minute and a half of this person's journey, and then we'll discuss some more. Oh, I skipped right past it. All right, just give me a moment, please. There we go.
Back pain, nausea, constipation, painful sex, cramps, painful period, bloating, vomiting, nausea. The list is long. Hello, everyone. My name is Saran, and I'm an endo warrior. I've been living with endometriosis for 25 years now, and it's only 2 years ago that I finally got a diagnosis. But that's an old story for most endo warrior, a sad one, but reality. I personally had to go through 8 medical professionals before I finally found one that took me seriously, that decided to listen to me, and then help me through this, process of getting a diagnosis. So, and that was for me a start to a journey of learning, a journey of discovery about an invisible disease. The reality is you have to be your own advocate. That's for me, that's my takeaway from this. You have to be your own advocate. There is nobody that knows yourself better than yourself, and you have to step up and take basically your endo game to another level by educating yourself, learning about it, and doing all the research that you need to do to be on top of this. Because the reality is that really helped me by reading and discovering so many good and valuable information. I was able to really adopt a holistic approach to my endo.
Right. Okay. So why advocacy? And we heard the myriad of symptoms that conditions can come with, right? So benefits of self-advocacy can include autonomy, right? So the ability to take control of your life and life direction, a fulfillment of your needs. So you need relief from pain, you need assistance with family planning or fertility information, whatever it is that you need, rest, you need a break, right? Advocating for yourself can lead to a fulfillment of these needs so that you can feel better. Let's say you have a family and you are cooking and you're cleaning and you're this and you're that and you're feeling a bit run down, right? Advocating for yourself can mean saying, you know what, XYZ, do you mind doing the cooking today? I'm not feeling very well and I need some rest. That is also a form of self-advocacy, right? As we do this, we have, and Julia mentioned it as well, increased self-confidence. So the knowledge that, you know what, yes, I know my condition, I know how I'm feeling, and I am comfortable speaking up for myself when I need to. Self-advocacy also leads to informed decision-making, right? So I have done my research, I'm aware of my condition, and I have been keeping track, right? I may bring someone to the office with me if I don't quite remember everything, and they're also able to remind me of what was happening. And now I can make informed decisions about my health and my life, my well-being. Benefits also include appropriate access to relevant resources. So by asking questions, by making sure that I'm choosing the healthcare provider that is appropriate for me, now I have access to the resources that I need to take care of myself holistically. And then, of course, finally, support with undesired symptoms. So whatever symptoms you are experiencing as a result of your condition, self-advocacy can lead to a reduction in those undesired symptoms. So let's look quickly at our rights, okay? Because yes, we know as people, we have rights, but we don't always remember what these are. I'll read through. It says, I have the right to ask for what I want. And as I read through, I just want to see if any of these rights kind of resonate with you, if there are any that you're like, you know what? I know in theory this is a right, but I don't actually put this into practice. Like I don't actually, make sure that I take advantage of this right that all of us have. So again, I have the right to ask for what I want. I have the right to refuse services or resources that do not meet my needs. I have the right to change my mind. I have the right to express my feelings, whether positive or negative. And there is, of course, a way that we express our feelings, but we'll get into that shortly, right? There are optimal ways to express feelings in a respectful manner and so on. I have the right to determine my priorities. I have the right to advocate for myself. I have the right to feel scared or afraid, right? And often we feel like if we have to have this mask, this persona, this kind of stoic disposition where it's like, I am unfazed. I go in and I'm just, I have no feelings. That's not true. As humans, we feel, right? And one of those emotions may be fear, uncertainty. And you have the right to feel afraid or uncertain. And then based on what it is that you are experiencing, to see what we can do to remedy that, to rectify that. I have the right not to justify my decisions. If I make a decision in my best interest that doesn't cause harm to other people, I don't have to justify that decision to you, right? I have the right to be treated with dignity and respect. I have the right to play and be frivolous. And I love that one, because why are we so busy all of the time and not taking time out to laugh and to enjoy ourselves, right? We should be laughing often throughout the day. It shouldn't be at the end of the day when you finally get the chance to go on IG or TikTok or Twitter or watch Netflix or whatever that you finally laugh. We have to be enjoying the day throughout. And if we're not, what is stopping us from feeling that enjoyment? I have the right to experience honesty from others. And if you realize that you're in a space where you're constantly being lied to, we may have to adjust those persons around us, right? I have the right to take breaks from advocating and to ask for help, right? So we're speaking of self-advocacy, and soon we're also going to speak of, when should I not be advocating? When should I be asking for help instead? I have the right to feel angry. Again, our feelings or emotions are valid. We do not always have to say, I'm fine. You know what I don't like? I'm sorry, segue. And I know we do it to be polite, right? Hello, hi, Julia, how are you? And the automatic response, I'm good, right? Why? I don't know why we do it, but we do it. And I guess the ideal is for us to hear, okay, well, someone else is doing well, when that's not always necessarily the case. And it's okay to say, in trusted spheres, I'm not doing so great today. I'm not feeling so happy today. I'm not feeling whatever today. That's okay. I have the right to say that I am not ready or I'm unable to meet the demands and expectations of others. And I have the right to receive copies of anything that I sign. Right? Work-related, especially, let's make sure that we're reading all of the documents, that we're receiving copies, even if there are letters that we receive from a healthcare provider to take to another healthcare provider. And I think my mother taught me this at a young age. I had an envelope and she said, I said, well, I have to take this to XYZ practitioner. And my mom is like, well, what does it say? And I said, well, I don't know. It's not for me. It's for the healthcare practitioner. And she's like, well, open it and read it. Like, but, and she's like, no. So you're supposed to know the information that is being carried from one doctor to another. You have the right to access, right, notes about you so that you know exactly what is being said. So let's look at some steps in self-advocacy. I'm going to pause. Are there any questions or comments at this point before we move on? Okay. So we want to first engage in regular self-reflection. So just like we did that grounding exercise at the very beginning, we want to have an idea of how we've been feeling, how I'm feeling now, how I've been feeling in the past few weeks, whether we are taking the time to journal, whether, we have like some sort of tracker of our emotions. For me personally, I have a calendar. And let's say headaches are a symptom that I may experience often. If I experience a headache on Monday, I might put a little H for headache, and I might put a number next to it. So a 5 or a 7, right? Or depending on the severity of my pain. And in that way, I'm able to, if I go to a doctor, I can say, okay, I can see for the past 3 weeks, this is how I've been feeling. This is how often I've been experiencing symptoms and so on, right? And if I can go a little bit more detailed on my calendar, I can also put events or put any anomalies in food or whatever, or I can reflect my menstrual cycle on this calendar so that I can see how I've been feeling, how it kind of intersects with other things that have been happening in my life. I find that personally useful. I find that other people tend to find whatever documentation useful as well, right? So checking in, taking a moment during the day, at the beginning, at the end, in the middle, whenever, to say, okay, well, how am I feeling right now? Am I feeling tense? Am I feeling stressed? Am I in pain? Am I upset, right? Am I scared about something? What are my short and long-term needs? What do I need in the short term? Perhaps I right now I need pain medication because I'm not feeling well. Perhaps right now I need something to eat because with PCOS, I've been having challenges losing weight, for example, and therefore I've been not eating appropriately because I feel like, oh my goodness, I'm scared to eat, which happens, right? We find that with some conditions, they're associated with other mental health disorders, any other issues, including issues with eating and body image, right? So what are my short-term needs? What are my long-term needs? And then what do I need to do in order to acquire these needs? What do I need to do to achieve what it is that I feel like I'm lacking? So regular self-reflection and self-advocacy is key. We cannot advocate for ourselves if we do not know what we're advocating for or what it is that we need. Step 2, education, right? So what gaps exist right now for me in my knowledge of my condition, right? What do I know? What do I really understand? And what don't I understand? When doctors use these terms, do I know what they're talking about? Is it a case where I can perhaps scribble it down in my phone, and then when I go home, I can go to a reputable website or reputable resource and find out some more? Can I ask my doctor more about what it is that they're speaking about? What more would be useful for me to know? Treatment options, workplace policies, right? Am I aware of treatment options, for example, right? So education is key. And Julia did touch on education quite a bit, right? It's also important to rally a support system. So considerations may be, where can I find aligned healthcare providers who can support me in my goals, right? So we mentioned proximity already, so making sure that I don't have to travel too far to reach a healthcare provider, but also making sure, again, that the healthcare provider is aligned in terms of their temperament, because sometimes you go to even a mental health care practitioner, right? And they may be wonderful, but your temperaments may not align, and therefore it may not be the best match. So again, if we have the capacity to find an appropriate resource, let's do that as much as possible. I mean, means shopping around, looking around, asking a friend, like, who do you go to? Who's really working for you in order to get that information? What conversations do I need to have with friends or with family, right? Particularly with family members who may not empathize with the condition, with the symptoms of the condition, who may not understand, who may not be aware, right? We've seen, for example, with endometriosis, it takes quite a long time to receive a diagnosis. And in the meantime, what is happening with adolescents, right? Why is it that they have to kind of just deal with whatever excruciating pain they're experiencing, right? That shouldn't be. So what conversations do I need to have with friends and family so that they understand the condition and so that they are not using words that are harmful for me and in my existence, right? So again, a common one within, I can speak to the Barbadian context, not as sure about the St. Kitts context, right? Let's say the condition is affecting fertility rates. Yeah, it could be, so when do you expect to have children? Why are you what is the purpose of asking me that question, right? And then what is the implication on me as a partner, as a woman, as whatever? What is it that the person is trying to say? And not even necessarily realizing how harmful that comment can be, right? Another one, we spoke of PCOS, we spoke of weight. Oh, you get fat. And again, medications as well can contribute to weight gain. And again, in the Barbadian context, so quick to say, oh, how large you've gotten, right? And how is that supposed to be helpful for the individual? What is the appropriate response, right? So if you realize that your friends, your family members, they're making these disparaging remarks, perhaps uninformed remarks, it may be important to have conversations with them about the condition, about what you're experiencing, and about what you are willing to to listen to and what you're not willing to listen to, right? And it may also mean, because of course we can influence people, we cannot control them, removing yourself from a particular space and finding a space that is more uplifting and more conducive to your well-being. What information, including documentation, needs to be shared with if you're going to school, I'm not sure if age range is here, with my school, with my university, my place of work, right? Again, we mentioned sick days. If you have them, you take full advantage. If you don't know the sick day policy at your workplace, it may be useful to find that out. I was working somewhere for years and never realized that there were sick days built into my job until I happened to ask somebody. They're like, oh yeah, you don't know we get 3 sick days every 3 months? And I'm like, no one ever told me. So it may be important to receive that information. Finally, we're going to want to speak our truth. So be clear when you're sharing your experiences and your needs, whether it's with healthcare providers, whether it's with your family members, with your friends. You want to speak authentically, right? And clearly and unapologetically. We want to reach out to relevant people who can provide the relevant support and/or resources. We want to be polite, yet persistent if we are feeling misunderstood or if we are feeling dismissed. And then finally, we want to be confident, right? So we mentioned experts before. Yes, the healthcare provider is an expert, but when it comes to you, no one knows more about you than you, right? You are the expert on you, and repeat that in your mind. So even when the doctor is saying, oh yes, and a lot of stuff that we may not necessarily understand, you know how you feel, right? You know what it is that you are experiencing. You are the expert in that regard. So speak confidently when you are advocating for yourself. Thanks, Joanne. Yeah, and again, any questions, any comments, any stories to share, please feel free as we go along. We're going to look at some advocacy styles because we mentioned how important it is to advocate for ourselves, but there are ways that we can do it that may be not as effective as other ways, right? So for example, there may be the people may, I should say, utilize an aggressive approach when advocating for themselves for various reasons, right? Perhaps I've just been so frustrated with my experiences in the past that I've gotten to a point where I don't have any more tolerance, right? I am fed up. I can't be bothered. I need what I need. It's important that I get it right now. And therefore, I may utilize an aggressive approach. And that can look like negating other people's experiences or negating their expertise, right? Which is not quite what we want to do. Yes, we want to center ourselves as an expert in our own life and in our own health, but we also need to acknowledge the experiences and expertise of other people, right? And even if I have one condition and Julia has the same condition, we may have two completely different experiences, and that is valid, right? So negating other people's experiences and expertise, that's not what we want to do. Attacking others is also not useful when we are advocating for ourselves or for other people. We don't want to attack, we don't want to insult, because often that leads to people becoming defensive, and now we're both in here warring, right? We're both in here feeling upset, and we're not making any progress. Same thing for disrespect, right? Whether it is, and that can be verbal, it can also be nonverbal. So if Julia is my healthcare provider and I'm just rolling my eyes, I'm sucking my teeth, I'm just, my body language is not respectful, as my healthcare provider, Julia then may not feel like, okay, well, why am I wasting my time explaining all of this to her? Like, let me just get her out of my office, right? So we also have to be aware of our body language. Lack of active listening, right? So yes, we are advocating for ourselves and sharing our experiences. However, we also have to make sure that we are listening to the healthcare provider or to whoever else, right? Listening just not so that I can just reply as I feel like, but listening to understand what it is that they're saying, perhaps jotting it down, asking questions, right? So that I can then share my point of view in a respectful way. And then finally, lack of self-awareness. So not even being aware that I am appearing aggressive in a particular space, not even being aware that I am being disrespectful or that I'm attacking or that I'm negating someone else, right? That's also a part of an aggressive approach to advocacy. So we have this first example. I
My
think I
name
named
is
her Anne. We're going to hear from Anne, and then let's see some opinions on Anne.
Andrea.
Oh, Andrea, sorry.
I am 52. I was first diagnosed with endometriosis when it must have been when I was about 30 or 31. I have been grappling with overbearing, excruciating pain for decades. Before, doctors never used to pay me any attention, but they pay attention to me now because I put them in their place. I do not hesitate to let doctors know that they are stupid, that they don't know what they're talking about when it comes to my body, that they need to go and educate themselves further, that their license needs taking away. I let them know all of it because this is my body, it is my life, and I'm the one at the end of the day that have to be living with this condition. I let my manager know too. If I need a sick day, I don't ask for the sick day. I take the sick day. It doesn't matter who it affecting. That's nothing to do with me. Because at the end of the day, I have to be looking out for me. At home, if I cannot get anything done because I am in pain, I just don't do it. I don't have to tell anybody anything. And if they come around me foolish, I will tell them something, but not necessarily what they will want to hear. You have to look out for yourself.
Okay. I'd love to hear some thoughts. What can we identify from Andrea's, I guess, approach, Andrea's perspective? Anything valid, anything maybe not as valid? I'm not going to move on until I have some opinions here. So let's talk about it, especially within the context of utilizing an aggressive approach to self-advocacy. What are we thinking? Yes, Julia.
The first thing, and thank you for that scenario, it really puts things into perspective because sometimes we may not necessarily recognize that it comes across as aggressive to others. But one of the first things that really jumped out at me is the fact that whilst it's not that we are necessarily begging people, because healthcare providers have a duty to provide healthcare, but with this type of approach, you may also unknowingly to you make it more difficult for yourself. So she spoke about saying that this doctor has to get their license revoked. What if that's the only doctor in that country? What if that's one of 6 doctors in that country? And that doctor is in network with all the other providers in that country. And now you have been deemed this difficult patient. And just like you said, practitioners might not necessarily want to engage with you because of concerns of aggression towards them, towards their staff. Again, in a small context, you might even find out where the doctors live and things can escalate. So yeah, I think it could create a sense of fear within, again, depending on the context, the network of the medical community, and put yourself at a greater disadvantage of receiving healthcare services.
Absolutely. Thank you for that, Julia. And that's exactly right, right? So we definitely understand and empathize with this person's frustration or anyone's frustration if they're in this particular scenario. But then when we're considering approaches, if we are approaching advocacy in a combative manner, then it puts us more at a disadvantage, especially for providers who may not be tolerant of that sort of approach. For our employers, if we have employers, right, that can be a sign of for them, okay, well, this isn't a very respectful person, why are they on my team? It can be an issue with family, right? So I think she mentioned, you know, if she doesn't want to do, she just won't do it, she's not saying anything, it's just too bad for you. And again, we understand, we empathize with pain and so on, but there are more effective ways to get the message across without offending other people, without putting other people on edge or on guard. Yeah. Let's move on to passive approaches on the other end of the spectrum. So if I have a passive approach to advocacy, and we tend to see this almost as frequently as the aggressive approaches, right? Or even more so. So it may be a case of negating your own rights and your own needs. So we spoke about it towards the beginning, saying, you know what, I don't want to really bother anybody. I don't want to seem, you know, like I'm taking up too much space. So therefore, I'm not really going to say much at all, right? I'm focusing on making other people happy, but my own needs are unmet. I accept condescension, belittling approaches towards me. That's something that I accept if I'm using a passive approach. So a doctor says, well, I hear what you're saying, but I am the doctor in this space. And I just say, yeah, you're right, okay. Because they are the doctor and they do know what they're talking about. And maybe what I'm feeling isn't actually what I'm feeling. So I just won't bother to say anything, right? And then not wanting to be a bother or to inconvenience anyone. So you keep challenges largely to yourself. And then going back to the aggressive approach, Jacqueline says, thank you, Jacqueline, the aggressive attitude and belittling the doctor or whoever may be in her mind trying to stop her. A calm approach and asking kindly can work. Absolutely. Thank you. Right? So we have the aggressive approach, we have the passive approach, we have a scenario to kind of explore the passive approach, and then we will talk about it again.
Hi, good afternoon. I hope you're all doing well. Like Andrea, I have had some challenges with my health. I am not sure what. I do have chronic pain, chronic fatigue from what I can see on the computer, but I don't really like to make a big deal out of it. Like I feel like there's so much that is going on in the world. Like people are facing so many more important things, I think, than just pain and fatigue. So I don't really like to burden people. I'm just about making people smile, you know, putting others before myself, which is what you're supposed to do, you know. So I grin and I bear it. At home, sometimes like sex with my partner is a little painful, if I'm honest, but sex is an important part of relationship. So I am giving in that way. I do what I think is necessary, you know, to make sure the relationship is smooth. It's not fair to withhold sex, you know, just because I experience a little bit of pain. I don't think that that's fair. I do go to my doctor. I think that's important, but if my doctor tells me that the pain is normal, then they're the doctor. You know, I did not go to medical school. I don't really know. I assume that perhaps I just need to take it a little bit stronger, like don't be as wimpy. Women go through this all the time, right?
Okay. Any standouts, any takeaways? As I'm listening to her speak, I can even identify like past thoughts that I may have had, right? In terms of, okay, I don't want to make other people uncomfortable. I don't want to seem like I'm being a bit too much. So therefore I keep things to myself. If we're looking at self-advocacy, this may not necessarily be the most effective approach either, because yes, while it can be viewed as kindness, you're putting others before yourself, you're being humble and so on. At the end of the day, you are doing this at the expense of your own health, your own daily functioning, your own well-being, right? So there is a balance. We don't want to be too aggressive in our approach, and we don't want to be too passive and laid back either, right? Which takes us then to assertive approaches, which is what we are aiming for, right? So with an assertive approach, we explore and acknowledge, again, our current realities, including our quality of life. So when I say quality of life, I'm really referring to, okay, on a day-to-day basis, how am I generally, right? How am I functioning? Am I able to go through my day and execute whatever activities I have in an okay manner? Yes, sometimes I may be tired. Yes, sometimes I may experience pain. Are these occurrences, stress, whatever, does it interfere with my ability to execute my tasks properly every day? Am I able to function? Is basically what it is, right? So when we're looking at quality of life, am I in general, when it comes to my mood, am I generally okay? Yes, there will be ups and downs. So one day can be devastating, another day can be excellent and exciting and exhilarating. On a day-to-day basis, in general, how would I describe my emotions, right? And if I say, well, I am usually feeling quite low, and that is a norm for me to feel low, then that's something that may need to be examined. If it is a norm for me I'm always anxious all of the time, and it affects my interactions with people, it affects my work, it affects my school, it affects whatever, that may also be something to address, right? So it's important when we're advocating assertively for ourselves to be aware of our current realities, our current constraints, whether it's financial constraints as well, right? So ideally, for some, they may prefer private healthcare, but private healthcare may be very expensive. Medications may be very expensive, right? And this may be a constraint to the treatment and that I get for my condition. And I have to be acknowledging that and say, okay, well, there's this particular medication. It's quite expensive for me. What are other alternatives, right? Because if my doctor recommends this expensive treatment, and I say, oh yeah, well, yeah, okay. And knowing that I can't afford it and now I'm taking nothing, that's not helping my condition, right? Exploring current needs and potential barriers. So what is it that I need right now? What is a barrier to me getting what I need? Expressing yourself clearly and confidently, right? So not second guessing yourself or saying, well, they're the experts, so let me just shut up and say nothing, and not attacking or being disrespectful, but just speaking your truth in a clear and confident way. This is how I feel. I'm hearing you, doctor, but my experience hasn't quite been that. You listen and you clarify. So actively listening to what they're saying to try to understand. And then if there's something that is not quite what you meant, you clarify, thank you. I hear you. I appreciate that. I think what I was actually trying to say is XYZ. Being aware of your body language as well, right? And body language is powerful. Within Caribbean culture, for example, there may be different poses and different stances, and it may be there may be nuances and scent kits and so on. But just being aware of what you're saying with your body, with your face, as you interact with other people. For me, I know as my norm, my face just tends to be like, right? And I have to be very aware that sometimes that can come off as, okay, well, is she listening? Like, does she care? And I make sure then when I'm interacting with people, I try to smile as much as possible. I just try to make sure that that people are aware that I'm open and actively listening, right? So just being aware of body language is also useful. It may mean setting boundaries, time boundaries, space boundaries, various boundaries within our various spheres. That's important. And being an active learner, right? So we are making discoveries in science, in healthcare all of the time. It is beneficial to continue to be aware of what has been discovered. Of course, again, reputable sources, new treatment options, treatment plans, and so on, trends in my particular country, We find sometimes in the Caribbean that is not as easy to get to, but I think it's a work in progress. And hopefully in the next decade or so, we'll have a lot more in terms of tangible data, right, that can inform practices and policies, particularly within the healthcare field. So let's look at scenario 3.
I am Crystal Ann. Hello, everyone. I'm 42. I have been living with asthma and PCOS for the past 12 years. At least I was diagnosed 12 years ago. Initially, I had no idea what PCOS was all about. I had not heard about it. I wasn't familiar with it. You know, you hear about asthma, but hearing about it and living through it are two different things. So initially, I was a bit shaken up, but I said to myself, you know what? If I want to live a life that is as stress-free and as symptom-free and as pleasant as possible, then I need to know what condition I have. I have to be familiar with my body, and I have to work with a healthcare provider that shares similar goals and similar values of lifelong learning and goals of making sure that I, as the patient, am living life optimally. So I chat with my doctor all the time. Yes, sometimes I don't know the terms that my doctor is using, but if I don't understand, I ask a question. And I continue to ask questions until I am clear. Sometimes I do extra research online. I make sure that I go to reputable sources to do this research. And I'm clear with my doctor about the way that I'm feeling and what I'm experiencing, what is working and what's not working. If I need a sick day at work, I am clear about it. I explain why. I apologize for the inconvenience, and I'm clear about what I need. I do the same thing with my family, with my friends. You know, sometimes you want to go out, but pain and other symptoms may make that a little bit uncomfortable. So I state it clearly. You know, yes, I speak my truth, but I make sure that I'm also respecting those that I'm interacting with. For me, it's about advocacy, yes, but also respect and partnerships.
Okay, so I hope in working through that exercise that we're able to understand then, or have a greater appreciation, right, for approaches in advocacy and understanding how different approaches can garner different reactions, right? If I'm using an aggressive approach, I'm met with defensiveness. If I'm using perhaps a passive approach, I may not get my point across, and I may not receive the treatment. My needs may not be met in the way that I need them to. If I'm using an assertive approach, I am more likely to be heard because I'm actually saying how I'm feeling. I'm stating my reality, and I'm stating it in a respectful way that doesn't dismiss the other person or belittle them or, you know, negate their own experience and expertise. So with that in mind, we're going to get our notepads or note apps again. And for the next few minutes, we're going to be working through this exercise. So there are 2 questions with some parts, right? The first question, on a scale of 1 to 10, where 1 is far from ideal, right? It's dire, it's not good. And 10 is optimal, 10 is wonderful. Here is where I would rate the following, right? So if we're looking at assertive advocacy, we mentioned that part of it is reflecting, right? Reflecting on our current realities. So let's do that, right? Where would I rate the following? My relationships, that can be relationships within your family, within your circle, right? Your loved ones. How would you rate that? Do you have really positive relationships? They're understanding, you complement each other well, you're celebrating each other? Or are your relationships not as supportive, not as positive for you, right? Maybe they're relationships that you've outgrown, but you're still in them because you don't know how to cut those ties. Maybe you feel like these friends are not real friends, that they just smile, but then behind your back is something different. Maybe there's a lot of contention with a partner or nieces, nephews, children, whoever, right? So we're going to rate our relationships on a scale of 1 to 10. Secondly, we are going to rate our work comfort and satisfaction. So if we're currently working right now, how comfortable is this work environment? How satisfied am I in this work environment, in this workspace, right? And if I am not currently working and I would like to be working, right, I can also rate how I feel about this particular experience in my life right now. We're also going to be rating our daily functioning, right? So consider, do your symptoms related to your condition, do they affect my day-to-day activities, right? Am I able to function on a daily basis, or do I have to spend a lot of my time in bed because I'm in excruciating pain or discomfort, or I'm just not functioning, or perhaps this condition is at the back of my mind a lot and it's affecting my focus, my concentration. So we're rating how we function in general on a day-to-day basis on a scale of 1 to 10. When we are finished number 1, we're going to go into number 2, and we're going to consider, okay, what are my healthcare needs? What do I need right now? Do I need to perhaps see a doctor because I haven't seen one in years? Am I doing okay? Because that can be a reality too. I've been keeping up with appointments. I have my medication. I am managing just fine, right? We also want to look at, what are our work needs? Or it can be school as well. Do I need accommodations? Do I need awareness of sick day policies and so on? Do I need to have a conversation with my manager? Do I need, if I'm an entrepreneur, do I need more boundaries in time management, right? If you're running your own business, it can be easy to be running all day, every day, no stopping. Whereas like a more traditional, quote unquote, job, maybe just, okay, between this time and you're done. Entrepreneurship isn't always like that, right? So is perhaps a work need for me to set more boundaries, more time boundaries, so that I also have time to rest? Do I have the capacity to hire someone to assist, right? Because it's easy to say rest, but then what about the business? You want to make sure that it's still running and functioning as it should be. Do I have the capacity to hire someone to assist me? Do I have a family member who may be able to jump in, right? I've had friends like that who were running a business. Let's say they had a particular office, and while they were getting on their feet, use a mom as a secretary, right? Which is just fine. The mother was willing, and in that way, I don't have to be rushing to the phone and now I'm stressing myself out, right? So what are my work needs? What are my needs within relationships? Do I need more understanding from my partner, from those around me, my loved ones, my parents, my family, my friends? What are my self-care needs? Do I currently engage in self-care? And we're writing as I speak, yeah? Do I take time out for me? Whatever that might look like, that can be as innocuous as just, okay, I'm reading a book today. Last month, is this April? Yes, this is April. So in March, I took a trip, and it was a pleasant trip for me. And at one point, I was just lying down, the windows open, the breeze is blowing, and I opened a book. And when I opened this book, just a regular novel, right, I started to cry. And I'm like, this isn't a sad book. What's happening? I realized that I was so tense. I didn't even, and I hadn't read a book for fun in ages. And just the act of taking time to read a book was so powerful for me, because I hadn't been doing it in so long, and I hadn't even realized how tense I was, right? So it shouldn't be a novel experience to do something for you. It may not be a book. It may be listening to music. Back in the day, I have to say that now because apparently, wow. But back in the day, I had an MP3 player. I had an iPod Touch. That was the thing back in my time, right? And I realized slowly, I used to listen to this thing every single day, earphones every day, walking to and from university. Slowly, I'm not using this anymore, right? Until now, I don't even know where it is. And music was such a restorative process for me, right? And I know it is for so many other people. Your genre of choice, just listen to it, singing along, dancing for those of you who enjoy dancing, right? But if we're just going all day, where's the opportunity for us to carve out that space to do things that make us feel good? And it's not selfish. It's not selfishness. Even if it is 5 minutes to do a feel good thing, that's powerful, right? And especially if it's something that's done frequently. Like, no, these are my 5 minutes. This is what I'm doing right now. I've gotten to a stage in my life where I am not functioning well unless I write everything down. If I don't write down, I have this workshop today at 11 o'clock. I may not have made it, right? And I'm just being real, because I need to write everything down. So what I find myself doing now, I write in my self-care activities and I book it like I schedule it like it's an appointment, right? So I might get an alert, oh, it's time to lie down for 2 minutes. And I say, okay, well, if it's time, I guess it's time, right? And it can be anything. Again, it can be exercise, it can be whatever. So for D, we're writing what are my self-care needs? What do I need to help restore myself on a daily or weekly or monthly basis? Am I drinking water? It's a self-care thing too, right? What areas can I grow in, right? Where can I grow? What, because none of us have reached. No, no problem, Joanne. None of us have reached, right? None of us are there at the pinnacle of whatever. There is room in all of us for growth. So as we're considering advocacy, what opportunities are there for us to improve? Do I need to improve in my demeanor? Is my face perhaps too scowly when I speak to people and it's kind of off-putting? And yes, it's me and I shouldn't have to change for anybody, but perhaps I can be a bit more pleasant, right, when I'm speaking. Do I need to know more to understand more about my condition? Is that perhaps where I can grow further? Do I have to actually prioritize my health? Like I remember for me, again, for a period of time, I deliberately stopped going to doctors because I was so frustrated. I'm like, well, no one's listening. No one's hearing what it is that I'm saying. Everybody's telling me the exact thing without even listening to the story, right? And I got so frustrated, I just stopped going. Now, that solved the problem by me not having to be frustrated, but at the same time, now I'm not getting my needs met. So that's not a benefit for myself. So where I identified growth then, okay, Vania, obviously you need to find a healthcare practitioner that aligns with you and that will listen to you. And that is where I identified a need for growth in my own life. So for you, where can you grow? And then you're going to look at, okay, what's your usual advocacy style? So if you are advocating for yourself, do you tend to be assertive? Do you tend to be aggressive? Do you tend to be passive? And then no matter which of those styles you normally occupy, what can you do to be even more assertive, right? How can we get even closer to the goal? Do you have to write down questions more and ask questions? Do you have to be clear about, okay, well, this isn't working and this is working, right? Where is there room for growth in that area as well? So I'm hoping that you're getting the chance to go through this exercise. Please use it as a moment for introspection, for self-exploration. When you are finished, we'll just give a couple minutes. I'm being mindful of the time. Just indicate in the chat. I'll perhaps just give 2 minutes for this so we can cover everything. Thank you very much for joining. No problem, Joanne. Okay, we're going to, I see it's 12:51. We have 9 minutes. I do want to make sure we squeeze everything in. So we are going to continue. I want to talk about knowing when to advocate, right? And I use this this diagram adapted from Stephen. I just know it by seeing it, don't know the pronunciation. Covey, is it perhaps, right? This circle of concern, right? And I use this a lot as even as a reminder for myself, right? So when we consider life events, right, there are some things that we can control, right? There are some things that we can only influence. And then there are things that, yes, they may bother us, but we don't necessarily have influence over those things, right? So in our circle of control, maybe our self-care practices. I know we may say, I don't have any time, I don't have any time, but we do have time to be just like scrolling through IG, right? So there is a little touch of time that we can fit something, even if it's just 2 minutes a day, right? So we can control our self-care practices. We can control our personal goals. We can control the boundaries that we set with people. We can control our priorities, right? And just a quick note, what we say that we prioritize and what we actually prioritize are two completely different things. For example, I don't have, I usually have it next to me. I have this huge water bottle that I've been walking around with for at least 10 years, okay? And in my mind, I prioritize water, drinking water. So important, so this, so that, whatever. I realized some time back that I'm just walking with a heavy water, but I'm not actually drinking it, right? And it struck me, I'm like, why do I feel so dehydrated when I have this huge bottle of water? And then I realized, well, you have it, but you're not actually opening it, right? So what we say that we prioritize and our actual actions or actual behavior, what we actually do, can be sometimes two different things. So when we are looking at our priorities, just do a check-in and see if your actions align with what it is that you say you prioritize. And that's just an aside. So how we respond to others as well, that is in our control. Someone is very irritating, we can control our response. I may not feel like it at the time, but we can, right? How we respond to others and our thoughts. Food for thought, we can, in a way, redirect our thoughts as needed. Okay, we have a circle of influence, so we can influence our work relationships. We can tell people our boundaries and so on. We can tell people how we feel. We can smile at people to try to brighten their day. School friendships, we can influence behaviors, like say, you know what, I don't really like people shouting at me. We can try to influence that. Can't control it, but we can influence. And then finally, the circle of control, of concern, sorry, we cannot control the weather. We cannot control other people's health status or pandemics or politics, really, or other things. There are many things that we cannot control. So how do we know when to advocate and when not to? So I would engage in self-advocacy if I've identified a personal gap in knowledge, in treatment, in care, or a personal need. I may engage in self-advocacy if I feel unheard or unacknowledged, right? If I'm seeking clarity or relief, or if I have the capacity. That's very important. I should have put it in bold, right? If we have the capacity to engage in self-advocacy, that's when we do, and we've identified a need to do so. We may need to take a break to regroup, or we may need to ask for help if we do not have the capacity to engage in self-advocacy right now, right? We've been doing it, it's not working, I'm frustrated, my daily functioning is being negatively impacted by these advocacy efforts, right? I'm just feeling overwhelmed, I'm feeling overdone, I'm at my limit. I don't think that I can properly advocate for myself. I may need to ask for help from a partner, a parent, a friend, or a daughter, son, niece, nephew, whoever, right? If I'm experiencing disrupted sleep or worsened eating habits, worsened symptoms, worsened cognitive functioning, worsened mood, that may be a signal that I may need to ask for help. There are also times where we may have to advocate for persons around us. And I know I mentioned this at the very beginning, right? And this is very, I guess, near and dear to me because I've seen people be diagnosed later on in life and then have to struggle in between those times, struggle with feeling heard and listened to and seen, struggle with feeling validated in their symptoms, right? So especially when it comes to persons in your care, persons who hold less power and or less privilege, persons who may not be taken as seriously, right? Let's advocate for those persons in our lives as well. And many of these conditions that we are speaking about today affect women. So we're advocating for girls, right? For teenagers who have, in endometriosis, PCOS, and other similar conditions, right? If they say that this is how I'm feeling and, oh, but mommy's not listening to me, so I'm coming to you, auntie. Auntie, talk to mommy, talk it through, explain, provide resources so that we can get that adolescent the care and attention that they need. So very quickly, barriers, right? There can be, so we're speaking about self-advocacy and, oh, it's so great and this is what we should do. It does not always occur in an ideal setting. So there may be internal barriers and there may be external barriers in self-advocacy. So internal barriers may include a lack of awareness of resources. Like you keep saying, Vania, Julia, to go and find good resources, but where, right? And of course, context again is important. And hopefully there's a list in St. Kitts of relevant resources that you can go to, right? There may be a lack of awareness of your condition that may require more research. Oh, something happened on my screen. Is that a hand? Oh no, okay, right. Another internal barrier may be elevating others as the expert, right? So yes, they are the expert in the medical field, but again, you are the expert of you, right? Feeling inferior to a healthcare provider can be a barrier, right? If I feel like, I don't want to say anything, I don't want to sound stupid, right? That can be a barrier to getting the care that you need. And overcoming that is just a matter of saying, you know what, but I am the expert in me. Worrying about how you may be perceived. Like if I list all these symptoms, are they going to think like, do I need to go to all these different things that I may be concerned about, right? And then an advocacy style, again, can be a barrier. And we know that we are aiming towards assertive, right? Assertive approaches. External barriers may be a lack of access to relevant resources, due to financial constraints or due to distance or whatever else. Sometimes the doctor that would be doing what you need them to do is a huge distance away and it can be difficult to get there. That can be a challenge. Time can be a challenge if you are doing lots of different things in your everyday life, right? You're working, you're taking care of a family, you're doing this, you're doing that, you're studying. It can be difficult to access resources, right? Lack of job flexibility. So I may be talking about sick days and you may be saying, yeah, we don't have those at all, right? And therefore it's difficult to kind of advocate for yourself and for needing sick days if those are not something that are afforded to you regularly. Yes. And then a small or a non-existent support system. And I think cultivating your space, cultivating your support system is really, really, really important. And again, sometimes, yes, we cannot choose our family, but we can choose who we decide to be around, right? And who we allow to occupy our environment. As we get older, I think it's less about sticking with someone just because I've always stuck with them, and more about making sure that I am good for you and you are good for me, right? So when you're looking at setting goals, and I think I'm going to leave this up. I know Julia's going to do a close, but Julia, if we can like keep this up while we close, that might be great if we can, right? Goal setting. I like for self-advocacy that it's you combine doing with a condition. So you make a goal, and I have some prompts on the side. Your goal may be surrounding stating your needs more or learning more about something, asking your doctor about whatever, right, is pertinent to you, being less passive or aggressive in your approach. Your goal might be doing more introspection or taking time for yourself, finding a new doctor, connecting with a support system, speaking up when you need help. Whatever your goal is along this side, you can say, I will, and you insert a goal here, and then followed by that goal, when, right? I will do this when or whenever, and you insert the blank. And I have an example. So I will clearly tell my family members to mind their business when or whenever they ask me when I'm having children, right? I will take time for myself whenever I'm feeling overwhelmed, or it can be whenever I get home from work. Something that is realistic, something that is feasible, something that you can do within your particular context. I cannot tell you because I'm not the expert on you, right? You are the expert on you, so you would be able to know the best context to do whatever it is you need to do to improve your self-advocacy skill and approach and knowledge, right? So thank you very much. I'm going to pass it over to Julia for the close.
Thank you so much, Vania. That was so much food for thought. You know, I've been in this advocacy space, I mean, since we started VAEP, but you know, there's always something to learn when you're presenting. So I just happy that we were able to have this chance to share the wealth of information that you have as it pertains to self-efficacy with, again, our friends in St. Kitts Nevis. Recognizing it's 1 p.m. Again, I just want to thank everyone who is attending. Definitely thank you to Tarisha and Abby from Lake Health and Wellbeing for the kind invitation and working with us as we went through the process to make sure that we were able to design the best possible program for everyone today. I was in the process of creating a word cloud because I wanted to have some key words that we could all leave with. So what I'll do is I can post it in the chat, but I will also send it to Abby so she can also disseminate it. And if you hear something in the background, that's my cat. She's having a time. But suffice to say, so the word cloud is in the chat. So like some of the key words and phrases that were being repeated throughout this conversation that we've been having for you to take with you as you either start your self-advocacy journey or you are in the process of continuing it. We can be reached if you want to reach us directly to just ask more questions. Abby has all of our contact information, and so she can disseminate that through the network as needed. But just know that whilst we are not physically there with you on island, we are very supportive of all of these activities to really, again, empower, enrich, improve the lives of women and girls throughout the entire Caribbean. And so just really excited that we were able to have this opportunity, and hopefully everyone has a great remainder of the day. Thank you.
Thank you all. Thank you so much to Vania and Julia for taking the time. And thank you as well to all of the participants for staying on. We hope that you guys learned something from today. So we just want to stress 1 or 2 key points before we let you go. We know it's Saturday and we have lots to do. So we just wanted to make sure that we are thinking through our health literacy. We are going to assess, or ARE, assess, retain, and evaluate. Assessing what we know, asking questions to find out what we don't know, retaining information, and then evaluating how we should move forward with the health conditions that we might be living with. And then from Vania's side, when it comes to self-advocacy, we're really trying to lean more towards an assertive approach. But at the end of the day, as she said, that we know ourselves best and we are our best advocates. So we just want to make sure that we are doing what's best for ourselves so that we can live our best lives. So Lake Health and Wellbeing and the Barbados Association for Endometriosis and PCOS. Those are the 2 organizations represented today, and feel free to reach out to us. We really want to create sort of community and community of advocacy in St. Kitts and Nevis. So if we can support you on your journey with any of these illnesses and other illnesses not mentioned, feel free to reach out to us. All right, Abby, I think there was a form that you wanted everyone to fill.
Hi, everybody. So just to say thank you to Vania and Julia for the excellent workshop today. I think it was really informative, very comprehensive. So we do have a feedback form that we would like you all to complete. So as soon as you leave this meeting, it will pop up. And we just ask that if you could just complete the feedback form. It will take literally like less than 5 minutes to complete. It's very short, but it does help us as we try to improve on this project and also ensure that we're developing resources that are helpful to you. So thank you so much, everyone, for attending, and have a great rest of the day. But obviously, if you have any last questions or comments, then feel free to share, and we'll just try and wrap up in the next couple of minutes. So just to share some of the comments with Vania and Julia, someone has said this is a very interesting and informative session. Someone has said, thank you all for the information shared and the wealth of knowledge. And somebody has said, I believe if I knew what I know now, situations and challenges I had gone through would have turned out better for me in the past. Oh, bless you. Going forward, I'll be a great advocate for myself and others. Thanks again. And then somebody else said they enjoyed the session. Thanks very much. I have lupus. Yeah, so thank you so much. Really great session. So thank you so much. Appreciate it. So everyone enjoy the rest of the day. And if you have any questions that come to mind later on, feel free to email them. We also have a WhatsApp group, so you can put the questions in the WhatsApp group, and then we will share those with Julia and Vania to get any comments from them. So thank you all for attending. We appreciate it.